Hello, everybody. Thank you for having me for this invited talk at St. Louis University. What we will have in next 1 hour is kind of an overview of smart healthcare, what it is, and what we have done in our research group. I'm a professor at University of North Texas. I've been in this department for last 17 years. So uh, here is the outline of the presentation.
I'm turning the volume down.
Here is the outline of the presentation. We'll have some discussion of how healthcare evolved to smart healthcare. What are the characteristics of smart healthcare? What components make smart healthcare possible? What are some examples that we have done in our lab? What are the challenges and what future direction exists for new generation researchers? So a few slides and some time we devote on how healthcare evolved to smart healthcare. So what is human health? Is essentially human body is a biological microelectromechanical system. We have all the components that we can imagine, and health is the state of that system. Okay, and it may evolve. It may involve actually various components we have in the system, and mental health, physical health, all these are interrelated, and smart healthcare as a whole is able to handle these things. Traditional healthcare that we all are aware, the patient, the person who receives healthcare is essentially dealing with multiple stakeholders who may or may not be interacting with each other, and the user, the patient, has to deal with all these various stakeholders at a time, and so that he or she gets quality healthcare. So that has been the scenario. And then healthcare evolved to something called telemedicine, which we all are aware in this middle of pandemic, where we have been effectively using telemedicine ourselves. So essentially, telecommunication technology, video, and other things got involved in the healthcare sector, and as a result, telemedicine evolved actually from the traditional healthcare, and this has been doing quite well, not just 2020 because of pandemic. Last whole decade, I see telemedicine is playing an important role in providing healthcare for remote areas that I read from various newspapers as well as magazine articles. Electronic health has done quite well, as we see, like in last, let us say, 10 years or so, we have almost stopped using any physical form of prescription and other things that we used to have. And electronic health is essentially digitization, that means electronification of whatever involved in the healthcare has happened. And a long way to go. Electronic health has its own set of problems. Then another thing evolved at the same time is connected health. This, I think, have done quite well because the stakeholders like clinic, hospitals, suppliers, laboratories, all these are now connected. And for example, if we go to our primary care physician to have certain diagnosis, and then PCP sends us to have X-ray and other things done in a lab. So all these data, healthcare data, essentially now, because of they are connected each other, getting very easily, and we don't have to take our lab result and so on to the PCP physically. So in addition to that, PCP is able to send electronic prescription to the pharmacy so that we can go and pick up the medicine. All these are actually happening, and that is because of the connected health. And with the evolution of smartphones, as we see, and all the smartphones can have various forms of the sensor which can be used for healthcare purposes, whether it is a simple temperature sensor to a heart rate sensor and so on. All these are available, and as a result, mobile health also evolved from the traditional healthcare. And putting all these things that we saw, telemedicine, connected health, electronic health, mobile health, all these things, a bigger umbrella called smart healthcare is possible, and it's essentially the most complex. And the purpose, ultimate goal of this is to have quality healthcare. Everything that telemedicine does, everything that connected health does, all these things, and in addition to additional things that we will see in this discussion, what else smart healthcare is doing. And the underneath structure is what we call as IOMT, that is the Internet of Medical Things. So not just internet, not just connectivity, many other things are added together to give us the bigger umbrella called smart healthcare. And in this discussion, a few slides we have, we'll have more knowledge of what it is. So this is like simple examples like a fitness tracker to implantable to wearable. All these are there in addition to the data that we get out of all these, how they are being utilized for quality healthcare. All these are part of smart healthcare. So what makes smart healthcare possible? A few characteristics we'll discuss. It's a conventional healthcare, we can say, plus body sensors, biosensors, whatever wearable, implantable, all these things. Then smart technologies, like something that has a built-in AI mechanism or machine learning capabilities, information and communication technology, and then AI models are running either at the edge of the IoT or in the cloud or even at the sensor. Okay, all these together gives us what is called smart healthcare. And various related terminologies that essentially say the same thing is Internet of Medical Things, Internet of Health Things, healthcare cyber physical system. All these are different layers, we can say, of smart healthcare. At the end, we get the smart healthcare. It may be made up of IOMT or HCPS, that we will see. This is the bigger smart healthcare as a four layer structure of healthcare cyber physical system, if we see. So it's the human body, and the close network along with the human body is body area network, which is various sensors and their connectivity. And these are much more specific sensors, which is suitable for human body, that is one. And then the connectivity from the sensor, which can pass through the human skin and bone and so on. So these are specific connections that allows that. A variety of sensors are possible. Then the second layer is user interface. Okay, so user is a participant in the healthcare, and user also observing the health conditions. So various interaction layers are there. And a black box, which is third layer, which is essentially decision making. So different AI machine learning models that gives some indication of what is the health condition to the user as well as to the healthcare provider. For example, let us say with a wearable, what is monitored is, let us say, health heart rate. Then how good or bad is that heart rate? That kind of example. Or somebody is monitoring the stress, and how good or bad is the stress level. That kind of decision basically going either to the user or the healthcare provider with the help of a certain decision making, which is a and a machine learning mechanism. And remote access, so that means healthcare provider as well as other stakeholders who are away from the user can have certain information about the user. So that is another layer. So this is a four layer structure of healthcare cyber physical system, and detailed structure of is essentially Internet of Medical Things. And as far as devices is concerned, various sensors we will see, implantable and wearable, all these are essential, which are essentially giving various forms of data that from various types of signal, whether it is a signal from the brain or signal from the heart. All these are monitored, and then various conclusions can be done based on the data that is being obtained. So wearable medical devices, and there are plenty available nowadays. Last 10 years, there is, I would say, the market is flooded for in various type of wearables. The left bottom there is an interesting device which came 2 years ago. That was the first medical device that is monitoring the it's wearable that is monitoring seizure condition. Insulin pump is also wearable here, that came few years ago, and various fitness tracker and so on. This is also in addition to wearable, much more serious cases, implantable are needed and implantable are available. And I have one, what we have is a pill camera. Pill camera can essentially go to human body and can send data of human body, which is an interesting innovation, which gives much more insight of human body up to the doctor to examine things. And the brain pacemaker is another interesting implantable device which is taking care of certain brain conditions. And altogether, actually, is implantable and wearable medical devices, which are a very important component of the smart healthcare that we'll eventually see. Now, 7Ps, what we call, these are unique characteristics of smart healthcare, which traditional healthcare and other connected health and so on, that are different other paradigms that evolved do not provide. And these 7Ps are very important for a system to be called as a smart healthcare system. First thing that I have put in the middle is personalized. That means basically the user who is using the smart healthcare system, the healthcare is personalized to his choice and to his health condition and so on. So there is more or less direct attention to the individual. Then other thing, participatory is another important characteristic. That means the patient is participating in the healthcare. Okay, that means he or she is aware that what is his health condition much more, what you can say, accurately, and much more basically knowledge he has, so that he can kind of think and feel good about what is going on about the treatment and so on, and even preventives the user can take. Then perpetual, that means the healthcare is always there, healthcare provider more or less, and can make basically right assessments at right time. And predictiveness is another important. That means before things happen, for example, let us say if we can predict a few minutes before heart attack happens, or few minutes before seizure happens, then one can take precautions and so on. So these are 7Ps. These are 7 characteristics of a smart healthcare system. The machine learning aspects are very important in the smart healthcare system, and the task here essentially more or less, even though they are across certain boundaries like daily healthcare to clinical healthcare, and their diagnosis can be done on a daily basis, as well as prevention can be done at the same time. And at the clinical level, the various clinical diagnosis and clinical treatments are possible. So these are different task or characteristics of smart healthcare. And if we see what are the advantages and disadvantages smart healthcare provide compared to the traditional healthcare system, okay, advantages on the left and right are the limitations or disadvantages. And advantage, one major thing is real-time intervention is possible, optimization, optimal usage of resources, whatever available possible, and more standardization is possible because of smart healthcare, because different stakeholders are connected as well as user is also connected. There are various challenges we have solved quite a bit, like I see in last 10 years. So various researchers across US as well as around the planet are working in different states, not just our group. A group I see in, let's say, electrical engineering, computer science, biomedical, and of course in School of Medicine and so on. Okay, all people are working to solve, and we have solved quite a bit, but still there are a lot to be done. And it is a bigger market. Smart healthcare market is estimated roughly, as far as I remember, $300 billion market. Smart healthcare products are. That's why it's not surprising that a lot more electronics companies like are in the smart healthcare area. Okay, so security is an important point, and some standardization is done, but still a lot more standardization and communication protocol needs to be developed. Then better integration of data, a lot of data, and data needs to be, privacy needs to be preserved. At the same time, integration has to happen so that it can be utilized. Then the interoperability is actually important problem that was there in the healthcare, that is much more in the smart healthcare as well. Then market challenge point of view, there are still a lot of things. For example, it's not trivial for user to use the smart healthcare devices, wearables and implantable, even though they're scientifically is safe to use, but a lot of resistance is there. So those are the different advantages and limitations that we can see. And coming to the components, what are the components that smart healthcare? This is the simplistic view, which is Internet of Medical Things or Internet of Health Things, along with various electronic health record and then their connectivity and so on. Okay, all together and wearables and their connectivities. All these in a bigger picture make what is essentially smart healthcare, and we can say it's a collection of medical device, biosensors, and so on, plus AI, and then electronic health record. All these things together making smart healthcare. And IoMT is the specific instance of IoT where the sensors are biosensors and medical sensors, medical devices, and their connectivity. So as a result, because they're connected, there will be different secret and privacy issues, and my group a lot of things doing on this aspect that we'll be eventually discussing. And it's very interesting here, data security, data privacy, and device security also are important in the medical domain. So as a important component, sensors are key. Okay, and variety of sensors, because the human body is quite complex in terms of various signals involved. We can, like for example, EEG is electrical signal that we are seeing. Okay, and at the same time, when we are monitoring glucose, it's a different thing that we're monitoring. So various forms of signals are there, and they need various types of sensors, and then their connectivity. Okay, and in terms of sensors, we can say sensor for bioapplication, imaging application, heart related, and so on. Okay, in fact, motion detection, all these simple accelerometer kind of sensor is possible to use. So anyway, all these variety of sensors there, and those sensors then have to be connected. Okay, and connection through human skin and human bones are not straightforward. There are need for different standardization, and a lot of things are available, and a lot more can be done in this as well, because when they're connected, there are security issues, that is one, and when they are connected, they consume a lot of battery. So all these things are there, and still we have done, I would say, reasonable. Bluetooth is a very good connection for healthcare applications, and also other things are there, and Wi-Fi signal also passes, as I've heard, reasonably in the human skin. And another component of smart healthcare is EHR. The EHR, whether it's smart health or not, EHR is there anyhow. And when in the smart healthcare point of view, EHR, based on the EHR data, okay, we can predict a lot of things. For example, we want to predict whether right now basically where are different patients of a different specific health are staying, or what is the condition of, for example, allergy season, different allergies people are suffering. All these are possible to predict. So data is important, and based on data, we do the model, and then we make certain assessment for a whole city or for the country and so on. So AI and machine learning model are important, and here across whether it's various forms of data or various physiological data, environmental data, genetic data, all these, and coming from various implantable and wearables. Okay, so all these are offline data like electronic health record. Okay, all these various forms of data, and from the implantable wearable, the data we get, based on data we can do daily diagnosis or instant diagnosis. For example, let us say somebody has wearable, and wearable is telling somebody is stressed out or not stressed out, or what is the level of stress, and those kind of examples are here in the left side. Okay, that is instant some sort of assessment. And then here in the offline data, then we model, we could to predict, for example, this season, this was the flu condition, next season, what can be the condition, and similarly allergy and so on, those kind of prediction we have in the right side here. So data is important. Based on data, we develop model and then we make a certain assessments. So this is one important component as well, along with the sensor and connectivity. And then much more, what you can say, things are being developed in the smart healthcare domain. And one particular thing I like is the brain-computer interface. And many of you may be already aware, for example, Neuralink that Elon Musk is promoting to have brain-computer interface. And what I'm interested in brain-computer interface is to help paralytic patients who to do different actions. Okay, so that means they're thinking some things, and then with the help of different BCI devices, we are able to think what they are doing, or we interpret what they are doing, and then basically actuator is making those things done. So that means it's a closed loop feedback where BCI is making certain assessment, sensing, that means, and then taking certain actions as through actuator, and then that is how the paralytic patient are getting help. So that's one example I like quite a bit as a BCI. So that's an important component. And another thing I'm seeing in the healthcare domain that has future, and some things have started, is virtual reality as a interesting component that I'm seeing being as actual for future. For example, virtual reality can be used for surgery, and virtual reality can be used as therapy for example, the right side diagram I got from internet, which is essentially therapy to have control of serious stress like PTSD and so on. So certain examples here also, which our group have been working on this area for last maybe 6-8 years, and I have produced 3-4 PhDs in this area. Before that, I was actually using most of my time for low power hardware research. So then I moved to smart healthcare research as a natural, because we have very good understanding of the electronics. So two of my students, PhD students, have worked on this. One graduated several years ago, right now faculty in University of Texas at Tyler, and another just defended last week. So we see stress is a very serious problem, and the statistics here in slide 28 gives you certain examples. For example, in US, 75% adults experience some sort of stress, and then 1 out of 75 have certain times panic disorder. Okay. And in general, the bottom line here is depression in general, which is one manifestation of that problem. Okay, is the leading cause of disability worldwide. 25% depression have access to, not necessarily have access to. 25% do not have, sorry, have. 70% do not have access to healthcare in this situation. So stress is important problem. That's why we put a lot of emphasis on solving this problem. And when we are doing the reading, we come from engineering background. We do reading. We collaborate with medical schools and so on. And then we figure out stress, the distress, which is the negative stress. It has a lot more problems, okay, on the human body. Lack of energy and diabetes can be much more aggravated, mental condition and so on, weak immune system, all these are because of stress. And so what stress is essentially doing, so body is reacting to any change, and as a result we feel stressed out, and various things resulted out of that. And this is our big picture, that what we have been trying to solve. First, in the big picture, we want to accurately monitor, okay, classify, okay, high, low, medium, whatever levels, and then accordingly we want to provide in the same its overall system, that system should provide certain advisory as a therapy or as a medication to the user, okay, and whether certain long-term measures or short-term measures has to be taken. Okay, short-term measures is as simple as that. Okay, doing breathing exercise or take a nap or take a shower. Okay, those kind of advisory. A long term is essentially including even go and visit the doctor. So we in this research we develop first accurate detection of the sensor from various data, physiological to eating habit and so on, various forms. And then we also explored various computing paradigms, that is IoT edge computing paradigm, IoT cloud computing paradigm, and to determine what computing paradigm is very good or most suitable for smart healthcare. All these things I've done. And as I said, two PhDs have been working and they have graduated in this area. And if we go to the market, variety of devices are actually available, Empatica to Garmin and so on. They provide data, but whereas like PPG and heart rate, accelerometer, all this data they provide, but they do not do like all what we intend to have, that is to determine the stress level and to provide advice how to reduce the stress level. So many things we have done, and one work what we call stress lysis is our objective is accurate and rapid stress level detection, and then decide which computing paradigm is most suitable. That means providing accurate result at the same time in the detection happens in a very fast so that actions can be taken. So in the stress lists, we counted on various physiological data, whether it's body temperature or physical activity through accelerometer, then humidity sensor we used for sweat analysis and all these things. And then these basically overall it is like a wearable that can be put on the palm. And then we developed machine learning models from the data that we obtained, and to classify the stress level and so on. And so this is a very lightweight deep learning model, and that can run in a variable which have very minimal computational capability. And we have validated this work with 26,000 samples, and it has accuracy level of 99.7%. And this whole thing has a very good user interface. The whole system we made, and the user can completely monitor what is the stress level. And then in the course of experiment, we studied how temperature affects, how humidity affects the stress levels, and how all these can be combined together to have very good accuracy in terms of stress level of the user. Then another work is a smart pillow we developed, which is basically sleeping parameters we analyzed, and then along with that we decide what is the stress level and whether somebody is having very good sleeping pattern. If not, eventually what can be done so that this is a stress point of view have certain solution for the user. So like one can say the various sleep trackers are there. Answer is yes, and we have highlighted the starting from Fitbit to 8 Dream Muse. All these are various fitness sleep trackers, and they do few things, and they also do not do. And what we want to achieve in the what we call as a smart pillow is to track the sleeping pattern, and then correlate that sleeping pattern with stress. So that means, let us say, daytime stress of a user can lead to nighttime bad sleeping habit. So how we correlate those and how we can then advise what to be done. That's the ultimate goal, which most of the sleep trackers that we see have certain drawbacks, and more can be done. So so here, basically, we monitored different things like the respiration rate, heart rate, snoring, and so on. And then we classified those different levels. And then a follow-up work is how we provide advice, okay, how to take care of that, and then somebody can better sleep better. So this is essentially monitoring automatically the stress level, and then added features allows how somebody can sleep better. And this smart pillow then evolved to another work. This is a much more comprehensive, what we called as a Saya pillow or smart yoga pillow. So, and this pillow is monitoring the sleep pattern very accurately, for different periods, starting from like somebody's just starting to sleep to deep sleep, all these different patterns, and then what are the stress level we are analyzing from that, and then we are basically advising. And in addition to that, we demonstrated a simple, along with this framework, how we can demonstrate that the data we get are stored in private fashion, that means privacy assured, so that nobody else is aware of the data. That's a demonstration of privacy aware healthcare through blockchain. All these things we have done along with this work that we will be discussing later on. And this smart pillow or sci pillow point of view, the validation done with a lot of data, and now we see that this is 90% accurate in terms of result of the stress layer and stress level and so on. Another work is IFL where we are like stress control mechanism we have integrated, and in this we have short-term advice and long-term advice along with so with various physiological data and so on. We are monitoring what is the basically different stress, and then we are advising. Okay, short term, for example, physical exercise, yoga, meditation, all these advice this device is giving, as well as long term different advices starting from workout plan, meal plan. All these is done through this iFill as a device. So short term remedies can include basically live approach or day end approach, and then weekly and monthly approach, long term remedies that this system called IFL is giving. And the framework IFL is a prototype again with off-the-shelf different electron component that we have. And this is with various overall 15 features we have, and stress detection, control, and so on. And the accuracy level of this is 97%. Then another work that again two students have done is basically is the diet. Diet is very important. Food is everything, and imbalanced diet is a serious global problem. And what is indirectly related, food is also a stress indirectly, but in addition it has direct problems. Obesity, tooth decay, diabetes, these are direct problems of imbalanced diet. Okay, and also blood pressure and so on can happen. These are different medical condition as a result of imbalanced diet, and we thought of looking at it, and we are happy that we really could do very good work, which involved fully automation of calorie quantification. That means somebody is eating, automatically it identifies what somebody ate and quantifies what the calorie. And we analyzed again what is available, and a lot of apps are there, my fitness pal to like eat right, and all these other. The market is flooded. If you take any like Android or iPhone and so on, you will see a lot of apps are there. Okay, and they have certain features, and they do not have a lot of features. So particularly lack of automation is one important problem that we see. Okay, and actually I was very impressed. A lot of these apps are doing reasonable in identifying different food automatically, but still a lot more can be done. So one work we did, what we call iLog. In the iLog, this is a fully automated system that has a 98% accuracy. And this system is basically, it's like a simple camera, okay, as a variable along with the glasses, or it can be a wall mount on the dining table, at the top of dining table. And then what it does, it takes pictures at certain time interval, and then automatically says what are the food somebody consumed, and then from that quantifies the calorie. Okay, that means you don't have to, many of the apps that we have, you have to manually enter a lot of information, and you do not have to do this here. Automatically the picture at certain interval taken, and it's very good accuracy, 98% accuracy in quantifying the calorie intake. And we experiment with a lot of different food and from the database that publicly available, and it's very accurate, and it's able to do fully automated quantification of the calories. And yes, we ate so much calorie. Then what was our another intention that we did is, okay, we identified, we quantified. Then what? And what we want to do, and when we're thinking that whether we can predict what should be the next meal once somebody eats certain calorie and certain types of food. So we did that. So diet prediction is another diet quantification, and then prediction is another work. And in here, like we are able to monitor what somebody ate, what is the calorie intake, and in addition to that, to say what should the next meal, so that overall it's a balanced diet, not somebody eating a balanced diet. And we develop model, again, machine learning models, deep learning in general, we can say. And then based on that model, we are able to predict what should be the next diet. And this model also working very accurately, 98%, 98.6% accurate in predicting certain food for the next meal, so that the overall diet is balanced, and the user doesn't have problems like obesity and so on. The another research problem we handled is epileptic seizure detection. Two of my PhDs worked on this area. One 2 years ago, one graduated, and 3 years ago another graduated. Someone is a faculty in New Mexico's University, another is, sorry, Eastern New Mexico University, and another is joined IBM. So what we did here, our research goal is to predict the seizure in around 1 second time, and we achieved seizure actually what we can say early detection, rather, instead of using prediction. Early detection in less than 1 second, and various models we explored, and also we came up with some idea of drug delivery and so on as a treatment mechanism. This is a serious problem as well. 1% of world population suffer from epilepsy, and a lot of them actually have a serious disastrous outcome in the form of what is called SUDEP. And we wanted to, that's why look at it. And in the market, very few things are available. This one came around 2 years ago as a wearable, and this doesn't take EEG signal. This is monitoring like different muscle conditions or activities and so on, and then predicting. That's why accuracy point of view one can question. Okay, so what we want to achieve is to monitor the brain activity through EEG signal, that means as a variable. And then what a lot of people are doing is what we call this location A, that means in 4 to 6 second lot, and 1 to 2 second few results are there. And we want to achieve in close to as much as possible 1 second, and that's what we two of my PhDs worked, and they succeeded. That's why they received their degrees. And in actually medical community point of view, and positive prediction is another important problem. And our collaborator in this Yale Medical School, they basically have same say, that is prediction is more important, and that problem is largely needs to be solved. That is how to predict before season happens. Yes, season happens, you can predict. Faster prediction, quicker prediction is not a problem, but before happening is another important challenge that is there. So in the PhDs that we produced, the research, our objective was to come up with this closed loop system, that is how to detect seizure or eventually predict the seizure at close to 1 second time. That's what we were trying to do. Okay, and that is early detection, 1 to 2 second time, and then have eventually prediction be possible. And in this research, on the other hand, we have handled is how to have a drug delivery mechanism in place, which can inject drug in very fast. So here also we experimented with cloud and its computing paradigm, and accuracy level point of view, they are more or less doing quite well. And latency point of view, as obvious, edge computing is better. And but still, like it's taking when we are doing the experiments, is one in 2 years ago, 2019 paper, it was in the range of 1.4 to 2.5, but we have product on better things, less than 1 second in some other works. So here also we explored deep learning models and various other combinations of models for basically in detecting the seizure and the seizure classifier and so on. All these we have explored quite a bit. And here one interesting work that we don't see many people doing, we tried, is to use what is called kriging as a model that we explored. So this is a geostatistical model which is used in geostatistics, and we found out that is morphologically, we can say, if we comprehend that Earth surface is meaning as the brain surface, we kind of see the parallelism, and we can use that. And we did very good thinking in that respect, and the results were amazing. That is, we saw that because of this correlated model, which is essentially spatial correlation, that means the locations when EEG signal comes, they are correlated, and we can model those. And as a result, what we see is the yes. So this slide has those answers. As a result, we see the Kriging classifier based seizure because it's capturing the correlation and so on, much more accurate and much more faster. Okay, and with 0.85 second, we are able to detect. So we also have some proposed certain control methods, and control methods are very important. Certain medicines are available right now, and focal drug delivery is one interesting mechanism that can be done, where drug is released at right time, required time, at right location. And so that's the big picture. That means like some certain drugs will be there, and that drug that means these are obviously for serious health conditions. I can basically inject drug, and so in this we are from the electronics background, not of medical sciences. So we kind of talked to. So this particular work was in collaboration with the Yale Medical School, where like we were trying to in this work is to come up with a model that will mm, release right amount of drugs from a pump reservoir. Okay, and we studied what kind of pump, whether it's electromagnetic or piezoelectric, those kind of pump which is most suitable, and what can release the drugs in the doses that doctor prescribes. So all these models we did, and we demonstrated a closed loop system that is releasing the drugs in proper doses. Another work we did is fault detection and prediction, and a lot of this is a problem for particularly elder population, and as associated problem, there are a lot of problems because of fall that happens, and a certain kind of capability we right now have, a lot of electronics have, but what we want to do in actually in this work, when we started, we are thinking how to predict before fall happens, and we have certain level of results with this. So existing research have its own set of issues, particularly prediction doesn't happen in the existing tools that was there. So we develop a device called Good Eye. Good Eye is a device that detects and which many are doing, but in addition to that predicts. That means before fall happens, it predicts yes, fall is going to happen. And this is actually an interesting device that is combining two things. One is taking pictures, image data, which many people are doing. In addition, many people are doing physiological data, that means accelerometer and other data, and we thought of combining all those. Okay, that means that is accelerometer as well as cameras involved. So this is multimodal data, and we analyze all those data and then do very good accurate prediction as well as detection of the fall. And along with that, so this is an example that is visually different data is there, and from the data, this system is telling you, okay, somebody has fallen and so on. And this obviously can be used for automatic warning and so on to healthcare provider. We have experimented and prototyped this good eye with which shows it has 95% accuracy. Another very interesting and I like this work is diabetes. Diabetes things we are talking about, particularly in this pandemic that we are going through. Diabetes in general has been a major problem and will remain because of eating habits specifically. And what is predicted in 2030, close to billion people uh, have diabetes, and 2045 it's close to half a billion, and by 2045 its prediction is 700 billion. So this is a significant problem. And like we see, that is invasive glucose measurement. There are like you can get a $100 device, and it takes your blood and gives you measurement. That is possible. But what we want to do, that is non-invasive. Okay, that is what our goal here. And that means it's like wearable. That is not taking in blood sample. It sends certain lights to the body and gives the glucose data. And we have developed certain spectroscopy that is doing that. And a long-term vision is the wearable or non-invasive monitoring. At the same time, insulin secretion as or doses as needed. That's the long-term goal, and a closed-loop feedback system along with all the security mechanism. And we have solved most of these components, and we are very pleased with the result, whatever we have. And as it was one prototype, we demonstrated it's a very simple, cheap prototype we developed with only $20 US dollar. We have a very accurate wearable device that is not taking blood sample, but sending lights to the body and giving us the glucose level. And very accurate. We validated this like regular blood as well as the serum glucose, all these things we have validated, and accuracy is more or less close to 100% in the healthcare. We have tested this in a hospital in with my collaborators in India, and this is medical grade, and we have the patent, and hopefully it will come to a product at some point. Now, challenges, we have shown a lot of examples starting from stress, food, seizure, fall, and then diabetes. All these are various things that we have handled, and several, as I said, 4 or 5 PhDs have graduated in this area. And but challenges are plenty. We have solved, a lot of people worldwide are trying to solve. In US, there are a lot of groups, so as other parts of the world. So healthcare requirements, as we see, needs to low power. Okay, we do not want to continuously charge our Fitbits like wearable or implantable, definitely not. And low power is very important in addition to continuous connectivity, high speed, security, privacy. All these are important challenges or requirements. And data quality is very important in the smart healthcare. Based on data, we do everything. Okay, whether it's glucose prediction or fall prediction, all these things too. Data is very important, and like data quality, that's in general is very important for the smart healthcare domain. And then machine learning, how do we develop from the data accurate model? And here, this is a much more challenging model compared to other application domains in smart city and other energy sector and so on. There everywhere that is machine learning models are used, but in the healthcare, we do not have the luxury to have cloud computing or heavy duty computing. We need our models to be light duty. So that's why in general, we use the term called tiny ML. That means lightweight, small, okay, tiny ML that will run in the end devices, or at most our models will run in a edge device like our like a Wi-Fi router, and somewhere that model needs to run and give us the results that we're looking for. So machine learning challenge, which is actually has a lot of issues that we see in this slide, including energy requirement and resource requirement. But what is important is the machine learning model in the healthcare sector needs to run on a very low resource with a very minimal energy consuming, and that is the challenge. Security, the moment we are connected, we have problems, various types of problem that we see in the regular internet are there, but in addition, these are unique challenges that we face in the healthcare domain. Okay, data privacy, data security, and device privacy, device security, all these things. And privacy, a lot of people in the healthcare give a lot of attention, and this slide essentially tells why. Okay, that is data privacy. Data is compromised in many ways with intentional or unintentional purposes or reasons. Okay, and but much more beyond that is this. This is slide number 81. Okay, yes, privacy are there, privacy issues. Okay, but these issues here we see are much more scary. For example, this prediction here, that is insulin pump can be hacked. Okay, or a pacemaker can be hacked for whether software problem point of view or hardware problem for whatever reason. Those are much more serious. Okay, imagine somebody is basically implantable device like pacemaker and so on, or insulin pump like wearable is essentially controlled by somebody else, by the hacker. So that is a scary, those kind of scary situation, and that's the reality. And those problems are much more challenging to solve. Okay, and in general, like any of these that we have, whether it's wearable or implantable, okay, because they're connected, they can be hacked. And these problems are much more difficult to solve as compared to the security problem in energy sector or so on. The reason being, these IWMDs, that is implantable wearable medical devices, do not have resource, do not have the computational capability to run, let's say, heavy duty security mechanism. Okay, and do not have a battery life. For example, a battery in a pacemaker has a life of 10 years, or a neurotransmitter has a life of 8 years. So there is not much luxury to have heavy duty security mechanisms. So that's why these are very hard problems, difficult problems that one needs to encounter. Some solutions. So in general, we can say that is in a healthcare domain, when as a design engineers, we are handling this problem, we need to optimize the energy aspect, security aspect, and it has to have certain level of machine learning capability, so on. It has to be safe, and it has to react as soon as possible, so that remedy can be done. So all these are different trade-offs, and we encounter and we have solved. And then in addition to this, the overall in the IoT platform, which is connecting the various devices and so on, not just computers, okay, and otherwise we would be calling it internet, okay, not internet of things. So then what kind of computing paradigm, okay, that will be suitable? Edge computing or cloud computing and so on. We have experimented a lot of these, and in the end, that means at the sensor, that means user's wearable, that domain data is very minimal, okay, but doesn't have much computational resource, and very rapid response is possible, of course, but it doesn't have the resource. So that's the trade-off point of view to think. Similarly, edge device, that means that is at home, for example, we can have heavy duty routers and so on, which will do certain computation for a health point of view. So it has less data, but it can do certain computations, and certain rapid response is possible. And cloud is the farthest from the user, very heavy duty, but it can have high latency by taking data, making decision, and getting back the result. So these are a different computing paradigm that one can explore in the smart healthcare domain, which is what we have done. And then so these are basically different solutions to address the challenges, and one can come up with better models, so hierarchical machine learning model and so on, and distributed machine learning models that we experimented and worked on. So this is hierarchy, that one layer of creating another layer of deep neural network, and then various as a result of this hierarchical model and so on, we can have potentially lightweight models overall that is accurate and that can run and run using minimal resource. So those things are possible. And also distributed learning mechanism one can do, which is similar to the federated learning that Google does, where like a lot of data is there, and the data we can train, and at the same time have lightweight models, which again we have demonstrated with multi-core and so on mechanism, like we basically trained, and we have here a set of models which are fast reacting and giving us the seizure and other things we experimented detection in less than 1 second time. So very accurate. At the same time, this is with very minimal data and very fast training. So three conditions we have experimented here, that is with only deep neural network, Kriging DNN, which is a hierarchical model mechanism, you can say, then distributed Kriging and DNN. So all these different things, and we saw a distributed as well as hierarchical model are much faster in terms of detection of a specific health condition. And in this case, we have experimented with seizure data, EEG data. Then security point of view, one student have worked and few are working right now. This student graduated last year. He's a faculty in Central Michigan University. What we did here, our objective was to integrate security mechanism in the healthcare, which has very minimal energy overhead. That was the point. So we integrated POF, physical unclonable function, a security primitive, which with the medical devices, and came up with the protocol at the user end, at the doctor end, terminal, and so on, so that we have foolproof solution. So this is the more overall big model that we envision, where POF as an additional small hardware goes to all these devices and then does the security for us. And user is involved, doctor, and so on at different what you can say terminals or different nodes of the IoT, how things are. So we demonstrated this, that this is doing very good security and doing the authentication, validation, all these things close to um, a second, let's say around close to 1 second time. And the power consumption in our experiment is 200 microwatt power consumption. Further, better can be done, but this is work that a lot of people liked, and we have at least shown that with very minimal power overhead, we have foolproof security. And this is another work that we recently published, and again, students are working on it, where we demonstrated healthcare data, how we can basically have in blockchain. And blockchain in itself, even though everybody is fascinated because of success of blockchain in Bitcoin and so on, but it's not straightforward for blockchain to be used in healthcare. And we ourselves have been working for last 2 3 years. Finally, we have some very good results, and this is one result where we demonstrated with our Sao Paulo work, that is how like a lot of users data, okay, can be stored in different blockchains, and overall they are in the cloud in this particular demonstration. And but the healthcare conditions are detected at the edge. That's the idea. Okay, but long-term storage is through the blockchain. And we experimented this blockchain specific what you can say environment, Ethereum, smart contract, all these environment. But we are also working on many our own blockchain, which is very light duty and not necessarily running in this public domain Ethereum and smart contract and so on. So this whole thing, Sarapilo, is a foolproof solution with a very good user interface and so on. And and so data is stored in the blockchain with a certain privacy, what you can say, preserving fashion, so that this is a demonstration how blockchain can be used in the privacy assurance and so on. And we have certain, what you can say, solutions, okay, for a COVID-19 perspective, okay, that everybody is going through. And when we have been doing the research, and then we have been reading, that is diabetes and so on is considered as one of the pre-existing condition which people have to much more worry for the COVID-19 point of view. And we have been working how non-invasive fashion we can monitor diabetes and so on, okay, all these things. So we thought of basically providing certain things in this, and this is our non-invasive approach that we have proposed for diabetes conditions, and we what we call as iGlue. And here we worked on, actually, as I discussed before, is a new spectroscopy method, which is a basically dual infrared spectroscopy, near infrared NIR, okay, with two different 940 and 1000 something or what you can say frequency infrared spectroscopy. And as a result, with this non-invasive approach that is predicting. And we can integrate this along with our diet detection and monitoring. And as a result, this is how the idea that we have, that is basically we have designed all these, that is food we are quantifying, and food so by identifying, then calorie we are quantifying, and we are correlating that with the glucose level, and then we are predicting what is the next diet. So that's a foolproof solution. And then one can keep track basically because of blood glucose level, what to eat, what not to eat, and then what can be the next diet, and so on. And this has very nice app, a mobile app for Android, and one can decide what to eat and what not to eat. Okay, and in the as a conclusion of whatever we discussed, I gave you a very broad overview of what is smart healthcare, what are the characteristics of smart healthcare, what components are there, what are the certain examples that we have worked, what are the challenges, all these things we have discussed. And big picture is IOMT, which is connection of different medical things, devices, sensors, and so on, and making a big thing called healthcare cyber physical system. That is essential the smart healthcare. Smart healthcare can reduce the cost of healthcare and give more personalized solution. Okay, and it's doing a reasonable job, variety of things being addressed, and a lot more to go, of course, to solve. And a future research point of view, how to have light duty machine learning model, we what we call a tiny ML. We have done some, much more can be done. And in the what is future evolving, what we call Internet of Everything, where more or less human beings are part of the internet. Okay, how smart healthcare fits in that, and when privacy, ethics, and all these things are taken into account, that is future research we consider. And security point of view, lot more we have done with POF, with blockchain certain solution, much more can be done. And this thing overall keeping trade-off of intelligence and security and so on are a lot more in the medical domain. So I'd like to thank all of you for listening to this talk. And I'm now next 15 minutes we have time, and I'll be more than happy to answer any questions that you may have. Also feel free to email me if you have further questions. So we have 15 minutes time for question and answer. Please unmute and ask.
Thank you for speaking today. I did not know that all of those things were part of smart healthcare. I have a lot of those apps on my phone already. Do you know how many of these apps are using our information confidentially for medical research already? Like MyFitnessPal or Chromometer, or, even like women have these cycle tracking apps. I mean, how much of this information is being used that can be used without our permission?
Okay, yeah, it can be potentially used, and that depends on individual company's user agreement. Okay, when we are installing the app, and we just agree, disagree, though we do in a hurry. So, but what they have written in that user agreement, that is one important thing that somebody has to look at. That for different apps, okay, different apps have different user agreement. But I 100% agree with the concern that you have, and it is a problem. Okay, and so that's the trade-off. Okay, that is if we use those smart healthcare related devices or apps, there are security, there are privacy problems. Okay, but that's the trade-off. And how do we ensure? That's why not just smart healthcare as how quality healthcare it provides, safety, ethics, all these are important things, like ethical aspect and safety aspect, all these are important actually. Let's say, for example, safety aspect, let's say you have bad battery in a wearable. Okay, if you have wearable but you have a battery in the wearable which is bad, and it's a direct example of the safety aspect. Then ethical aspect I see, for example, you are having a wearable or implantable, which is what I have read. I have actually, I'm editor-in-chief of IEEE Consumer Electronics magazine. I have published many user cases, which user experience. Let us say somebody has a wearable in his brain, what he goes through. So those are very serious ethical issues that I see, and much more as compared to just privacy issue. That means how uncomfortable situation, but he has no other medical choice. So those are much more problems compared to privacy, actually, ethical aspect, safety aspect. Thank you. Any other questions? Please unmute and ask.
We had one of our cybersecurity masters program directors come speak in the fall, and he talked about how much medical information can go on the black market. And I think what he was referring to a lot of, like the my charting and those sorts of things, or just medical offices being hacked. But I just think about those apps, even like the My Health app on your phone. Like how easy are those things hacked?
Right.
Yeah, it's fascinating that people want to spend so much money to buy your medical information. I mean, like, it'd be one thing if they were tracking how people use, the VivoFit 4 or whatever. Now that we're all working from home, but when it is attached to a person, I mean, that's when it becomes really expensive on the black market, I guess. So it's just interesting. It's really great overall, but scary implications for privacy.
Okay, so if no questions, please feel free to email me. My email is in the, somebody has question, it's in the chat probably. Okay, that's fine. Yeah, so please feel free to email me. My email is in the first slide. Okay, that is my first name dot last name at event.edu. You can find me if you search my name as well. Okay, so if no other questions.
We also CC'd you in on the email alerting everybody about seminars, so they should be able to search in their email as well.
Okay.
Thank you so much for coming.
Sure. Thank you.
Dr.
Thank you, everybody.
That was great.
Okay, thank you, everybody.
Bye.
Bye.